Hi, this is Neil from SingleBestAnswer.com. We are your essential revision resource to help you pass the UK MLA or the PLAB exam. We have mapped the GMC curriculum precisely. For every presentation, for every condition, we have corresponding questions on our question bank. If you go to revision mode, you can select from a whole host of features such as year group, difficulty, or even type of questions. So, today we're going to jump in with a short but quite tricky question. A 53-year-old woman with painful red lumps on the lower legs, pain in her ankles and in her left wrist for about 1 month, and morning stiffness as well. Well, initial thoughts are she does have joint pain going on for a month. There's a hint of it being inflammatory in nature. And these tender lumps on her lower legs, what could they be? Well, when we think of tender lumps on the lower legs, obviously she has some sort of rash going on. And it didn't give the game away by telling you that they're nodules, but I suspect that this is erythema nodosum. And this occurs especially on the shin. They're quite discrete nodules, and they're very tender to touch. And if you think of a patient with erythema nodosum and joint pain, especially ankle pain, then there's only one thing you should have in mind. Do you know what it is? It is sarcoidosis. Okay? And there's a saying we have in rheumatology, in that if you have erythema nodosum and bilateral ankle arthritis, it's sarcoid until proven otherwise. Now here comes a tricky bit. Which is the best test out of these 5 to look for sarcoidosis? It might catch you out here. The best test is actually option B, chest x-ray. And the reason you do chest x-ray is because sarcoidosis is primarily a respiratory type of condition. It is multisystemic, but you are likely to find some changes on the chest x-ray. The most common being bilateral hilar lymphadenopathy. You can also get pulmonary sarcoid with interstitial changes. So the chest x-ray, option B, is the correct answer. Let's have a look at the distractors and go through them one by one briefly. A and A, well, there's non-specific, but you get positive A and A in conditions such as lupus, of course, which can give you rashes and joint pains. So that might be your distractor there. But with the rashes in lupus, it's more photosensitive rash, rashes on the face, malar rash, etc. Let's look at C, rheumatoid factor, RF. Yeah, rheumatoid factor can be elevated in rheumatoid arthritis, but look at the joint distribution. You've got ankle arthritis and you've got a single wrist. Doesn't really fit with the sort of symmetrical small joint distribution of the hands that you'd expect in rheumatoid arthritis. Okay, so that's not the right answer. This is the tricky one now, option D, which is the main distractor. Some of you might have been tempted to go with option D because in the back of your mind there's an alarm bell ringing saying with serum ACE that's associated with sarcoidosis. Okay, this is why this question is so fiendishly tricky, because serum ACE is not the right answer, unfortunately. Serum ACE is not specific for sarcoidosis. It's not positive in all patients with sarcoidosis. And sometimes we do get a lot of false positives. So serum ACE is the main distractor, but it's not the right answer, unfortunately. What about option E? TB Ellis spot. Yep. TB can give you erythema nodosum. It can give you some joint pain, but generally it will give you respiratory symptoms such as productive cough, and you might also get fever and weight loss, etc. Okay. There's nothing really to suggest TB here. So it's one of those where it's neither here nor there. Okay, so let's go for option B, which is the right answer. And if you go across to SingleBestAnswer.com, you'll have plenty of more questions like this with explanations and links to online resources. Check out our YouTube channel. We will publish more videos like this. I hope you like this one today, and I wish you the very best in your exams. See you next time.